basically, when we look at vitamin and mineral deficiencies in patients with celiac disease, it's quite multifactorial, and there are several different reasons. Some have already been mentioned this morning. So one is that a lot of the grains and products that are out there are not fortified. Another is that patients sometimes have poor food choices of actually what they're eating. Others is that patients often restrict other things from their diet that could be more nutritious. And then the fourth and final piece of it is that the small bowel does have inflammation, and that also contributes to some of these vitamin and mineral deficiencies that we see. So as a physician, this is a little bit of a busy slide, but there are different ways that we can assess nutritional function in patients. And one is by, again, meeting with a dietitian and seeing what their total nutrient intake is. Others are really quantifying if there's any losses, identifying malabsorption where it does exist, seeing if there's other types of metabolic stress on the patient, overall assessing their body composition, and then lastly, evaluating if there's any organ or end tissue dysfunction. And for patients with celiac disease, there are several different causes of malnutrition. And it's important to remember that people can have malnutrition if they're underweight, but also overweight is also considered a form of malnutrition. So number one, patients could have decreased intake, and this could be for several different reasons. So they could have abdominal pain that causes them to eat less. They have early satiety, so we see a lot of patients who may have gastroparesis when their stomach doesn't empty, or there may be some small bowel dysmotility. They may avoid certain foods. Another cause would be malabsorption, so whether they have mucosal disease, if they have a lot of inflammation. They can also develop bacterial overgrowth. They can have pancreatic insufficiency that all contribute to malabsorption. Another reason would be increased losses in patients who have diarrhea. And lastly would be increased requirements, so especially in children that are actively growing. So part of the medical evaluation that we do is number one, taking a history. So a lot of times by taking a history, you'll be clued into different things going on in a patient's life. Two, physical exam, and really examining the whole patient very well, making them really put on a gown and taking a look at their skin and their eyes, their mouth. The other tests that we sometimes do include blood tests, also breath tests, and these are really to evaluate for different types of food intolerances or bacterial overgrowth. Endoscopy, as Dr. Lewis mentioned, and oftentimes we'll also obtain stool studies. So although they're not the most popular with patients, sometimes they actually do give you, very helpful information. And things that we can often look for are to see if there's any evidence of pancreatic insufficiency, whether or not some folks, I had a patient from Long Island actually, in the fall who was told he had celiac disease, but he had giardia, which is an intestinal parasite. Also testing for fat in the stool, and also to see if there's any markers of inflammation. And some of just the other things that we do as far as assessment are really measuring their height, weight, their body mass index, and then different laboratory values. There really aren't any set official guidelines or standards, but what we've been doing at the practice is checking for different vitamins, so vitamin A, vitamin D, vitamin E, different B vitamins, including B1, B6, B12, folate, obtaining a complete blood count, which most patients have already had, but also looking at iron, parathyroid hormone, calcium, magnesium, phosphorus, copper, and zinc. And again, getting an adequate dietary history from the dietitian, and also reviewing some of the medications, the vitamins, and the supplements. So a lot of times people don't tell you what vitamins or supplements they're on unless you specifically will ask. And one of the interesting things and why I love the small intestine is that you have a lot of it. So most people have about 20 feet of small intestine. And it's really interesting when you look at the small intestine itself, because if it was a straight cylinder, you really don't have much surface area. But the great thing about the small intestine is that it has the villi and also these microvilli on the tips of them that actually really add to the surface area. So you actually have about 2 million squared centimeters of surface area, so several tennis courts in what would be only 20 feet. And these are some endoscopic pictures. Most of you have seen these before, but on the left is what we normally would see in the small bowel. And then this is looking really closely up on the top right. You can actually see these beautiful, nice villi. And these are pictures up close where you can actually take a look at the surface, and you can really see these grooves and pits that really add depth and increase the surface area. So when we talk to the fellows and the medical students, we try to reinforce with them that the duodenum and the jejunum are really the big workhorses of the small intestine. So although most patients have 20 feet of small intestine on average, the duodenum and the jejunum, where celiac disease happens to wreak most of its damage, really interact with a lot of the vitamins and minerals that you do absorb. So the most important ones that we often see, and you may see deficiencies, would be things like calcium, iron, copper, zinc, as well as the B vitamins. So again, that's the really important thing, and I'm sorry that we have a bright light behind here, so it doesn't, I don't know if it shows very clearly, but just to remember that where celiac disease is affecting, this is the most important part of the small intestine. That's what I think. But so another thing that we do see is that a lot of the patients that we're seeing really restrict different parts of their food. So some of this is because they have intolerance to other things. So we have a lot of patients that may reduce lactose in addition to gluten. Then other people often, they may be vegetarians, so they may be cutting back on meat, eggs, seafood, soy, and this may predispose in itself to other vitamin and mineral deficiencies. So we try to have patients not restrict anything that they don't have to unnecessarily, and that's the danger that a lot of the diets that are out there, like in particular the carbohydrate-specific diet, is because it's really hard to get enough adequate calories and nutrition if you're cutting back on all of these things. So people are always really interested in vitamins, but sometimes we have patients that take handfuls and handfuls of vitamins, and it's hard to figure out exactly what they're taking. My husband's uncle is 85, and he takes 19 vitamins every day. So there are people out there that do this. So although patients have always been really interested in vitamins, it's starting to creep into the medical literature. So if you do a search on celiac disease and vitamins, there's not really that much research that comes up. But things are kind of slowly coming into the medical literature. And these are two papers that were published within the past year. So one was the group from the Netherlands looking at the effect of vitamin B supplementation in patients with celiac disease. And another, this was a recent article in Neurology looking at impairment. They had a case study of a patient who had vitamin E and copper deficiencies. So it is out there, and you may run into folks who do have vitamin deficiencies. So this is a picture of a giant cockroach behind a refrigerator. And the quote says, "What did you think happens to all those vitamins that roll beneath the fridge?" So for those of us in New York, we don't want to see this. So as Suzanne mentioned, the FDA website is a good resource, and it does have a lot of good information on it. Just one thing I wanted to say is that the reference daily intakes, so you may have all remember in the past people would speak about the USRDA. So they've just changed the terminology. It's basically about the same thing. These are dietary references. They're based for essential vitamins and minerals, what you should be taking on an everyday basis. And they basically have grouped them into different groups. So if you're a man, woman, child, depending on your age. So if you want to look, they're on the website. I put a few of these up here, and I highlighted some of the ones in yellow. So as Suzanne was mentioning, that a lot of the gluten-free grains as of now are not fortified. So some of these that you run into are thiamine, riboflavin, niacin, folic acid, B12, and B6. So these are the daily recommended doses for a lot of these vitamins. And if you look, vitamin C is really only 60 milligrams. Vitamin B6 is 2 milligrams. And vitamin D is 400. And of all the recommendations that are out there, vitamin D is probably one of the most controversial because people say that this is really inadequate. But for the most, this is what's common practice. And also for copper, it's 2 milligrams a day, and for zinc, it's 15 milligrams.